Hello and welcome to a brand new episode of Hop Start. Now, if you're an avid watcher and a regular viewer, you would know that Shuvro got the opportunity to go to Bangalore and interview some great companies. In fact, today he gets a massage on screen. Anybody wants to give me a massage here? Anyone? So unfair. Anyway, check out Shuvro's adventures in Bangalore where he gets a massage.
I'm Selvam, Chartered Physiotherapist and Orthopedic Manual Therapist from UK. I've been practicing for the National Health Service, United Kingdom for the past 14 years, and then we relocated back to India 3 years back, and I've been part of the Jindal family for the last 3 years.
Dr. Selvan, welcome to Hop Start, and great to have you on board. I featured JNI, Jindal Naturecure Institute, and from there I thought let's get a little more deeper into specializations, and which are integral aspects like yoga and all that stuff we did get to know, but physiotherapy, acupuncture, these are very important and integral part of our body functioning, right?
Yes.
And I am a little bit of a patient.
Okay.
I myself have an issue with my neck, and I keep on traveling, and we sit in the cabs continuously moving up down, which causes a little bit of a strain at times. So let's use an example here as a model. And let's see how our viewers can get something out of this.
Believe me, let's sort of try and give you some relief.
And they'll understand what physiotherapy is all about, right? Awesome.
Right.
So how do we tell them, how do we go
Kindly,
about it?
can you sort of come a bit more into the middle, please?
Sure.
Let's quickly assess your neck and then take it from there.
Okay.
Kindly, can you turn your head to the right for me, please? Can you come back to the middle, please? To the left, please. Kindly come back to the middle and drop your head to the left, please. Okay, come back to the middle and to the right, please. Okay, going to the right, you're not very comfortable.
No.
There is an element of stopping, apprehension coming in to sort of say, oh,
Yes.
let me stop.
Yes.
Can you just quickly have a feel for the back of your neck?
Sure.
Okay.
Wow, it's already something has been identified.
Good.
Quite stressed, huh?
Right. Yeah. The one on the left is the one which feels really tight when compared to the right.
The other side.
And that really affects your scapula and everything. It sort of just goes into the winging.
Right.
Okay. It must be more to do with the posture rather than anything else.
Anything else.
So shall we sort of do a quick manipulation to see whether we
Sure,
can sort of help you out?
sure.
Okay?
Okay.
Just give me a second. Let me just get something over here
Guys, that's
for
the
the
alone,
face. Brilliant. Okay, sir.
Awesome.
Glass off and have a lie down.
Okay. Is
Face
it okay
down,
with the
please.
shoes? And
No shoes.
okay.
Yes. Head down, please.
Okay.
Face down. Okay. Kindly bring your hand by the side, please. Good. Lovely. I'm just going to sort of have a feel for your trapezius muscle to sort of see how it feels. Great. It feels good. Okay, an element of tightness on the left side. I'm just going to lift your head up slightly and then fixing up the base of your neck. Let's see if we can sort of really crack this. And then go on to the other side. Brilliant. And that was it.
Yeah, I heard
Good.
it.
You heard it. That's lovely. Stay there. Stay there. And that does the job. Brilliant. So stay there. Good. Kindly get up for me, please. Okay, turn around and then
On the front
face
side,
up.
face
Yeah.
up.
And kindly bring your head out of the bed, please. So, a bit more up, a bit more, please. Fantastic. Brilliant. Let it go. Good. We'll give it a bit of a traction. And let's have a feel for the bones to see how the mobility is. Great. With the traction, I'm just going to sort of take it down, relax, good, let it go. That was it.
Yeah,
Let's come over here to the other side, and that's it. Stay there. Brilliant. Now, no more cracking.
No.
It's all about stretching and making sure that you feel really good.
Yeah.
Good. Kindly come over here. Fantastic. Good. The last touch. A bit of a gentle traction. Kindly let it go, please. Good. Lovely. Good. You are now good to go. Kindly slide down the bed.
Sure.
And kindly turn to your side and get up from the side, please. It's always good to get up from the side. Yes.
Perfect. Let me tell you, doctor, something.
Mm-hmm.
Even just this much of stuff which you did, it really like opened up. And I'm so glad that flying back to Delhi will be more easier for me.
Oh, thank you. Thanks for your kind words.
Yeah, yeah. And
Good.
no, it's just not to make you happy, but to be very frank, it did work.
Right.
And this is the advantage of physiotherapy.
Absolutely.
And this is what
We
makes,
need. This is the need of the hour.
Yeah.
And then thinking about all these NCDs.
Right.
And with the obesity and the unhealthy diet and lack of activity.
Absolutely.
Having started this Fit India movement,
Right.
now this is the time to sort of really push through
Right.
and then get people on the move and then do the activity.
Okay, so Dr. Selva, so this is what physiotherapy is all about. Now, since before the viewers start thinking that, hey, this is a career-oriented show and why are we getting into the medical aspect so much? The
True.
point is looking into this as a profession, as a career.
Absolutely.
What's your
Physiotherapy, it's an extremely good profession for both gender.
Right.
There is a myth that it is really good only for the male, but it's a pure myth.
Right.
Even female physiotherapists would be able to do exactly what I did right now.
Right.
It is not about the physical ability, it is the knack, the skill,
Right.
rather than anything else. So
Right.
it is ideal for both the
Right.
gender,
Right.
and it is an independent profession.
Absolutely.
So you can really sort of thrive on your own.
Right.
You don't have to really depend on other professions,
Right.
but you have to work with everyone. So it's about
So
the
it's
integrated
in
care.
sync with
Yes,
the other aspects as
absolutely. With allopathy, with naturopathy, with Ayurvedic. So you can work with different professionals.
Amazing.
So you have that ability to sort of work on your own at the same time to work as a part of the team.
yeah.
And then it's quite simple. Following your science in your PU or in your 12th standard, higher secondary, then you have your common entrance exam depending upon where you are.
that's what I was
And
about
then,
to ask
Yes,
you.
absolutely. You sort of go into the course. It's a 4.5 years course
Yeah.
with a 6 months internship.
And all
at the
that
end.
notion of being a boring profession.
Oh, not
but
at
it
all.
seems there's a lot of
Believe me,
excitement in
it
it.
is excitement. And I always keep telling my staff, we should never be satisfied treating one patient. So keep treating, keep treating, keep treating. You get better, the patient gets better, you get the positive feedback from the patient, and then just keep moving on. Keep moving. So, and there are so many specialities in physiotherapy, and then people think physiotherapy is only about physical exercise.
Yeah.
No, it is
it's
actually
just that
much
3
more.
weeks of in the hospital and then a physiotherapy will
yes.
come and just stretch your legs. And not
It is
much,
much
beyond
more. Starting from us treating a child in an intensive care unit for their chest care to patients who are admitted in the intensive care unit for their chest care,
Yeah.
stroke rehabilitation, trauma rehabilitation,
many.
spinal cord rehabilitation, even for oncology patients and patients who have had transplants, you need physiotherapy to get them back on their feet. And on top of it, we have the big back pain and the neck pain,
Yes.
for which we
one of
need the
them is-
manual therapist.
Yes.
So, yes. So
Dr.
that's
Selva,
it.
it was brilliant chatting with you. But before I quickly wrap up, what would be the tip or advice for people genuinely getting into this field?
Be motivated that you're going to be entering into a fantastic profession. You will be an independent practitioner, and never stop learning, and just go and enjoy the course.
Awesome. Never stop learning, guys, and enjoy the stuff which you are doing. Stay tuned. I'm going to talk to a specialist in acupuncture after this quick break.
2, 1.
Hi, I'm Dr. Srividya Nandakumar, practicing acupuncture in Jindal Naturecure Institute for almost 15 years now. I'm basically qualified naturopath and also a MSc holder in clinical nutrition and dietetics.
Guys, welcome back from that quick break, and as you guys know, I'm with a specialist in acupuncture. Doctor, let's start with this fact that acupuncture, of course we know about it. It's a concept of pricking pins to certain nerves and kind of healing our pains and a lot of things to do. But let's understand actually from the right person what it is all about.
So basically the acupuncture is all about balancing the energy of your body.
Right.
It is like we believe in acupuncture that there is a kind of energy present in our body that we call it as chi energy, and it has two concepts, that is yin and yang.
Right.
That is, yin is negative energy and the yang is the positive
It's
energy.
very Chinese.
Yeah, and we say that yin and yang has to be always perfectly balanced if the health has to be maintained. And what happens when there is imbalance in the yin and yang, that is the basic reason for all the ill health, we say.
Right.
So by doing the needling, we are taking the points in different meridians through which the energy flows,
Right.
and by pricking those points in the different meridians, we are trying to balance the energy. We are trying to clear the blockage for the energy flow, and we are trying to balance the energy.
And since our nervous system is like this electricity, like main system.
So
in
that
the
is, this
body.
is the basic concept of the acupuncture. But what exactly the modern science says is all these points, acupuncture points, are near the nerve endings.
Right.
So what happens exactly when we prick a pin? What you feel, the first sensation you feel is a pain.
Right.
So this pain is sensed by our nerves, and the message reaches the brain, and from pituitary gland a kind of chemical gets released.
Right.
And they are very similar to the neurotransmitters, and they are the reason for all the different effects what you get because of the acupuncture. Like one is pain relieving, then second sedative, then immunity improving,
Right.
hormonal balancing,
Right.
and the metabolism improvement, and the motor
So
recovery.
a lot of
like-
things can
yeah.
be connected and treated through
Yes,
this,
sir.
right? I see few needles or something. Could I be a model of you to
Yeah,
kind
we
of
can just
understand
have
a
it.
little bit? So and there are a lot of points like
Actually, the human body has around more than 500 to 600 points. But we select few points like 15, 20, 25 points according to the problems the patients are
Right.
coming up with.
Right.
So depending on that, we take up some points and we give the needles there and leave it on your body for 30 to 45 minutes.
okay.
So the one course of acupuncture goes for 7 to 10 days or 12 days.
Okay, so it's a lengthy process.
Yeah.
So it's just a demo which you're going to see because
Yeah,
nothing
it's
can
just a
happen like
needling
Fair-
demo.
Fair
I'll be
enough,
doing
fair
it.
enough, fair enough.
So it's just a small prick, sir.
Sure,
You
sure,
feel,
sure,
keep
sure.
the hand relaxed. Take a deep breath.
Okay, that's how it goes.
Yeah, that's
And
it.
there are like different points.
There are
which
very
you-
different, so many different points are there, and acupuncture is very effective in mainly the pain relieving problems,
Okay,
pain problems, and sleep related.
right. That's what I was
Yeah,
about to
like
ask you
this.
actually. What are the treatments through acupuncture actually?
It's mainly very effective in pain problems like arthritis,
Right.
cervical spondylosis, lumbar spondylosis, sciatica,
Right.
migraine. Migraine, it's a very, very effective problem.
And a very common
Effective
problem these
treatment.
days.
And the sleep related problems like insomnia, disturbed sleep,
Right.
sleep apnea,
Right.
and also the problems like hypertension.
Yes.
It's very effective. And metabolic syndromes like obesity, diabetes mellitus, also it's very helpful.
Yeah.
And spinal injuries and many, like especially paralytic also. In case of paralytic recovery, the motor recovery,
Right.
it helps a lot. As a combination therapy along with physiotherapy,
Wow.
this is very
So it's
effective.
quite become an integral part if
Yeah.
we are taken seriously. Wow. And now
just
you'll be
remove
kind of
the-
taking her? Okay. Although in few seconds or whatever, did something happen to, do you
No,
think?
actually, you will, this, when we do it, it's a non-filling treatment. You will not feel them much, sir.
Right.
But
eventually,
actually, what happens, that is the reason we keep it for 30 to 45 minutes.
Right.
Because the stimulation,
slowly the-
stimulation caused by the needle pricking is very, very minute. So that is why you're required to do it for at least 30 to 45 minutes.
Fair
And also you need to repeat it for 7 to
For
10
some
days
time. Fair
or 12 days maximum. And we can treat like from the age of like 6, 7 up to 70 years we take up the patients.
And how
of-
does someone pursue this as a career? How does what are the qualifications?
Right now in India, it's acupuncture is taught as a part of naturopathy,
Right.
and in a bachelor degree. And there are some other places where we get diploma degrees and master degrees, which definitely I would not recommend because it's not actually associated with universities.
But this treatment goes really way back, right? And
Yeah.
it's a very old treatment followed by different.
In actually, frankly speaking, some form of acupuncture is prevalent in India also,
Right.
but it's developed as a science in China.
in China itself.
So the basic textbooks what we study in naturopathy also regarding the acupuncture, it has all the points name in Chinese.
In Chinese, basically.
So we learn like both the names,
Fair
the
enough,
number
fair enough.
and the Chinese
So now,
names.
if someone want to really specialize in this particular field, it is recommended if
Yeah,
someone
you
can
take
get
up
a
the
course
bachelor
in
degree in
China
naturopathy.
itself. Or naturopathy. Right.
There is a college in Chennai, the Naturopathy College, which has started with MD degree in acupuncture also, 3 years MD degree.
Great.
Otherwise, rest is like outside the country. So there are universities in Sri Lanka, in China, which has very good short-term courses,
Right.
long-term courses and all.
Right,
So
programs for particular
so
disease.
and knowledge there is like very, very nice.
Very nice, yeah.
And
Doctor, it was great. Thank you so much. I'm sorry I couldn't continue the chat because of our time constraints, but this little bit was a lot of information for me and for
Thank you,
my
sir.
viewers. Thank you so much for joining us in Hopstar and giving this insight. And I wish and I hope that our viewers learn that these are old methods and these methods can be taken up as a profession and also help to cause treat so many issues in people's life.
Acupuncture, like to take it as a profession, in fact, this is one of the best method where with minimal setups, minimal investment,
Yeah.
we can start the practice.
Right.
Like
You don't
yoga.
need too many
Yeah,
things.
yeah. You
It's
don't need
just-
too many.
But you need to be very aware of the points in the body.
We just need one
a place to kind of,
pot
yeah.
to take the patient and some of the needles.
Absolutely.
That's all
and
we
then
require
the
in
process
acupuncture.
starts. Amazing. Doctor,
Yeah.
thank you so much.
Thank you,
Thank you
sir.
so much for being part of our show. Thanks.
Thank you.
2,